Hello, coders. Hello. Happy Monday. As always, let me know in the chat if you can hear me. Let me know if you can see my screen, and we will go ahead and get started. All right. Hello. Awesome. Okay. Well, like I said, hello, and most importantly, welcome everyone new and returning to another week of our ICD-10-CM Guideline Mastery sessions. I am Miss Haley. I am going to be your lead instructor for this class, and I'm so excited to welcome everybody. I would also like to introduce my wonderful team. I'm sure you've already seen them, greeting everyone and already being their most encouraging selves in the chat. They are going to be there during this class to help answer any questions you may have and to just cheer you guys on while we are mastering some guidelines. So we are going to be beginning week 6 this week. So today we will be going over and reviewing some respiratory, integumentary, musculoskeletal, and urinary guidelines. As always, I'm going to be using our ICD-10-CM book as well as our MCG manual. I'm going to kind of go back and forth referring those, so definitely make sure to have those handy if you can. And we are going to keep the same flow as we have been doing. We're going to do our true or false Jeopardy questions, and then we're going to go into some in-depth scenarios that are related to our week 6 guidelines. So without further ado, I'm going to go ahead and read this copyright super quick. So ICD-10-CM Copyright 2026, American Medical Association, all rights reserved, fee schedules, relative value units, conversion factors, and or related components are not assigned by the AMA, are not part of ICD-10-CM, and the AMA is not recommending their use. The AMA does not directly or indirectly practice medicine or dispense medical services. The AMA assumes no liability for data contained or not contained. ICD-10-CM is a registered trademark of AAPC. AAPC content found within this presentation is copyright of AAPC. Keyboard concept, FTR, Chun, AMCI Fab 7, AMCI ICD-10, Flip Tap, and MCG are trademarks of AMCI. The credentials CPC, CRC, COC, CPMA, CPB, CPPM, CPCO are owned by the AAPC. AMCI does not own the rights to these credentials. The credentials CCA, CCS, CCSP, RHIA, RHIT are owned by AHEMA. AMCI does not own the rights to these credentials. Whew. All right, so we are just going to jump right into it, and we are going to do our warm-up Jeopardy. I'm going to stop sharing my screen for just a second and go and grab our game. If you are new, this is going to be a kind of just like all of the questions are going to be true or false. So you're just going to put your answers in the chat, and then we will go over them. And at the very end, I have some slides that have the questions, the answers, and the guideline where I found all of these guidelines. So if you want to look back on this recorded line and you want to pause the video so you can look and take your time and practice with some of these guidelines, you are more than welcome. These categories for our week 6. So we have chapter 10, diseases of the respiratory system. We have chapter 12, refer to guidelines found elsewhere. That's why we're going from chapter 10 to chapter 12. We also have tissue, and last but not least, chapter 14, diseases of the genitourinary system. Okay, so without further ado, let's get started from our chapter 10. And again, these are all going to be found within your ICD-10-CM book or your MCG manual. So let's see what we got up first. Okay, true or false? For patients presenting with conditions related to vaping, assign code U07.0, which is the code for vaping-related disorder, as the principal diagnosis. I'll give you guys about 30 seconds to get those answers in the chat, and good luck. All right, it has been 30 seconds, so this is going to be true. Yes, the patient presents with conditions related to vaping. This is going to be the code you are going to use, and you are going to use it as the principal diagnosis. So everyone that got that one right in the chat, amazing job. Now we're going to move over to our chapter 12, our diseases of the skin and subcutaneous tissue for 200. Okay, true or false? If a patient is admitted with a non-pressure ulcer at a certain severity level and that progresses to a higher severity level during their stay, only assign highest severity level during admission. So only use one code. What do we think about this one, guys? Let me know in the chat, true or false. Okay, so this one is going to be false. If you look in the ICD-10 book, or if you look in the MCG manual, the exact guideline is going to say if a patient is admitted with a non-pressure ulcer at a certain severity level that progresses to a higher severity level during their stay, you're going to assign two separate codes, not just one code. You're going to code one for the ulcer's site and severity at the time of admission or present on admission, and the second for the site and highest severity level reached during the admission. So the code for the present on admission should be sequenced first. And again, I will reference this exact guideline when we go over it in the PowerPoint later. So if you caught that one, great job. Let's move right along to our chapter 13, musculoskeletal systems. 100. True or false? The seventh character D is used for encounters after the patient has completed active treatment for a pathological fracture and is now receiving routine care during the healing or recovery phase. So what is this seventh character going to be used for? True or false? Let me know in the chat. All right, 30 seconds is up. So the answer to this one is going to... This is what, if you're using that seventh character in these codes, if you have to use it, if you're choosing D as the seventh character, that is what it is going to be used for. In contrast, if you're using the seventh character A for the pathological fracture, it is going to be indicating that the patient is receiving active treatment for the fracture. So that would be the opposite of this one. And in this case, this is going to be true. Again, if you got that one right, outstanding. All right, and let's now go to our chapter 14, diseases of the genitourinary system. Let's do a 100. True or false? Sequence CKD or chronic kidney disease with diabetes or hypertension codes using notes in the tabular list. All right, so a sequencing question. What do we think for this one? Let me know in the chat and then we will go over it. Okay, 30 seconds is up. Great participation everyone is having so far in the chat. Definitely keep it up. The answer for this is going to be true. So yes, when you're coding for patients with that chronic kidney disease who also have conditions like diabetes mellitus or hypertension, the sequence of the chronic kidney disease code, you should follow the guidance provided in the tabular list. So obviously, this is going to ensure proper sequencing based on your coding conventions. So you definitely should be using that tabular list and looking at those notes for sure. So great job, great job. Now are we going to start back off from our chapter 10? Let's do a 300. This is a long one. Okay, true or false? If a patient is admitted with a type of pneumonia, an example of this would be J13 pneumonia due to Streptococcus pneumoniae, and later develops ventilator associated pneumonia or VAP, the code for the admission is the code for the admission pneumonia should be assigned as the principal diagnosis. I apologize. So again, this is going to be a sequencing question. So yes, if a patient is admitted with pneumonia and that develops into ventilator associated pneumonia, are we going to code this code? True or false? Let me know in the chat. Okay. So, yes, this one is going to be true. So, yes, a patient coming in with pneumonia, developing into a different kind of pneumonia, you are still going to assign the original or the code for admission pneumonia that would be assigned as your principal diagnosis. So, everyone that got that one right, amazing job. Again, I will reference all of these guidelines in our PowerPoint. So, keep up that participation in the chat. Now we are going to go to our chapter 12 for 100. Again, true or false. If a non-pressure ulcer is documented as completely healed at the time of admission, an ulcer code should still be assigned. What are we thinking? Let me know, true or false, coders. completely healed. So if something's completely healed, we are not going to use code for an ulcer. So if you caught that one, great job. Moving right along to chapter 13, let's do a 200. True or false? Category M81, which is osteoporosis with current pathological fracture, applies to patients who have a current pathological fracture caused by osteoporosis at the time of encounter. So is this the correct category? True or false? Okay, time is up. I was trying to be a little sneaky with this one, so this one is going to be false. Everything about this statement is correct except for the category. So this should be category M80 instead of M81. So that's what makes this incorrect. So category M80 is going to be the category for osteoporosis with current pathological fracture. And that's what would make that one incorrect. So category M81 is the category for osteoporosis without fracture. So those are the differences between those categories, and that's what makes this statement false. So as always, if you caught that one, great job. And hopefully we learned something. If not, but still, we are loving this participation in the chat. Definitely keep it up. Answers are flowing in. And now we're going to do our chapter 14, our genitourinary system for 300. Oh, I meant to change this one. Okay. Surprise, now we have one that's not true or false. So with chronic kidney disease, what is stage 5 severity also known as? Is it going to be A, moderate chronic kidney disease, B, renal disease, C, end-stage renal disease, or D, mild chronic kidney disease? What do we think, coders? Let me know those answers in the chat. All right, amazing job. So yes, this is, where is my mouse? So everyone got this one right, I'm pretty sure. So yes, stage 5 chronic kidney disease is also known as end-stage renal disease. So great job. That was a good little mix up from our true or false. And let's do our last question from chapter 10, respiratory system. Okay, true or false? Acute respiratory failure, or ARF, should not be coded as a secondary diagnosis if it develops after admission or if it is present on admission, and should be coded as principal diagnosis. So how are we sequencing acute respiratory failure? Let me know in the chat. All right, 30 seconds are up, and this one is going to be false. So this one is going to be false. If you look again in the ICD-10 book or MCG manual, it is going to say that acute respiratory failure or ARF may be coded as secondary diagnosis if it develops after admission or if it is present on admission, but does not qualify as the principal or first listed diagnosis. So this statement is kind of flip-flopped, and that is what is going to make it false. So as always, if you caught that one, great job. All right, now we have our last question from our chapter 12, disease of the skin and subcutaneous tissue. Okay, if an ulcer was present on admission but has healed by discharge, assign only the site and stage as it was on admission. Oh my goodness, on admission. So is this statement going to be true or false? Okay, the answer for this one is going to be true. So yes, we are coding site and stage as it was on admission if an ulcer is present but has healed by discharge. So amazing job. You guys are absolutely killing this warm up. We have just a few questions left. Let's finish out our diseases of the musculoskeletal system and connective tissue. Again, true or false? Code the bone, not joint, for conditions near joint ends. So an example of a condition would be osteoporosis and avascular necrosis. So how are we coding the joint ends? Let me know in the chat and we will go over it in about 30 seconds. All right, time is up. So this statement is going true. So an example of a situation where this would be coded. So if a patient is diagnosed with that avascular necrosis at the end of the femur near the knee joint, although the affected area is near the joint, the code should be assigned to the bone. So that would just be an example of something that you would refer the guideline for. Hopefully that made sense. Again, I will reference the exact guideline where it says this, but this statement is going to be true. So outstanding if you got that one right. All right, we have one more question, then we'll move on. So let's end this on a good note. You guys have been killing it so far. Oh, this is going to be a long one. Okay. True or false? For patients with a kidney transplant who still have chronic kidney disease or CKD, the CKD itself is not considered a complication of the transplant unless there is documented evidence of transplant failure, rejection, or another specific complication. So I'll give you guys a little more time because I know this is a long one, but let's end on a good note. Let me know true or false in the chat. All right, all right. So this statement is going to be true. So yes, when it comes to kidney transplants, if a patient still has chronic kidney disease, but it's not considered a complication, unless there is documented evidence of transplant failure, rejection, or another specific complication. So if you got that one right, great job. And I am going to stop sharing my screen for just a moment, and I will switch back over to our PowerPoint so I can show you guys super quickly where I got all of these guidelines from. And again, this is going to be a recorded session, so if you need to go back and look at these slides, and you can pause it and take your time and get some more, as much practice as you need to. It will be found in the live section in our YouTube, on our YouTube page under the live section, and you just scroll down until you find this video. So this is going to be from our Category 1, our Chapter 10, Diseases of the Respiratory System. This is going to be the question, the answer, and lastly, the guideline that I referenced for these questions. So this is from our Category 1. This is going to be from our Category 2, so Chapter 12, Diseases of the Skin and Subcutaneous Tissue. Again, question, answer, and the guideline reference. This is going to be from Category 3, so Chapter 13, Diseases of the Musculoskeletal System and Connective Tissue. And last but not least, this is going to be from our Category 4, or Chapter 14, Diseases of the Genitourinary System. So again, if you have any questions, you can always look back at these. And if you have any follow-up questions about these that you wanted to ask, we have our survey that is going to be posted throughout this this class, and you can click on that and you can ask any follow-up questions or in-depth questions if you need me to go over anything that we've gone through in this lecture, and I will definitely get back to you. So definitely make sure to click on that link and let me know, or just to give us some feedback on how we are doing in this class so we can make it better for you guys, so we're learning as much as we possibly can learn. So with that being said, how are we feeling? Let me know in the chat. And I am going to move on to some in-depth scenarios. I will stop sharing my screen while we are typing in the chat, and I'm going to go ahead and grab our Quizlet. So if you have not attended one of these classes before, or if you just need a little refresher, we are now going to move on to our 3 in-depth scenarios. So I'm going to present a scenario, and then we are going to break it down into 3 components. We're going to break it down into keywords. We're going to break it down into the guideline we're going to be using to find these codes. And then last but not least, we are going to find the ICD-10-CM codes that best fit the scenario. And again, you are going to be putting your answers in the chat. Is this from the beginning? Okay, perfect. Okay, so our first scenario of the night, I will read out loud. So a 70-year-old patient is brought to the emergency department with worsening shortness of breath, wheezing, and chest tightness. The patient is diagnosed with acute respiratory failure with hypoxia and is placed on ventilation. Further evaluation reveals an underlying acute exacerbation of chronic obstructive pulmonary disease, or COPD. So what keywords, we're just doing keywords for right now, and put those in the chat. What keywords are going to best describe this encounter? What keywords are we taking out of this encounter to finally find our codes? Let me know. I'll give you guys about a minute to type them in the chat. All right, it has been about a minute, so if you are still typing in the chat, please continue to do so, but the keywords that I'm taking out of this situation are going to be those signs and symptoms that they listed, the shortness of breath, the wheezing, all of that. Also the acute respiratory failure with hypoxia, and then also that COPD that they mentioned in this scenario as well. So if you put anything along those lines, great job. Good to see everyone is on the right track. Now we are going to move on. Same scenario, but now we are going to be picking out what ICD-10-CM guideline best describes this encounter. Again, we are going to I just giving you a clue. It's going to be in the respiratory section just to kind of shorten it down so we know where to look for this particular guideline. You can put the title or the name or the number, however you want to do it, but let me know in the chat what guideline you think best describes this encounter, and then we will go over it. Okay, it has been about a minute. So if you put that guideline in the chat, amazing job. So the guideline that we are going to be using to solve this is going to be IC10B1, and the title of that guideline is going to be Acute Respiratory Failure, more specifically, Acute Respiratory Failure as Principal Diagnosis. So if you got anything along those lines, great job. And now, last but not least, we are going to use those keywords and we are going to use that guideline and we are going to find our ICD-10-CM codes that best describe this encounter. Again, I'll give you guys about a minute for this, and then we'll switch over to the PowerPoint so we can kind of see how everything looks all together. So good luck, everyone. All right, it has been about that time, so I'm not going to give away the codes just yet. I'm just going to stop sharing my screen and switch over to the PowerPoint so we can see how everything looks kind of side by side with the keywords, guideline, and the codes. All right, so this is our scenario. I won't read the whole thing over again, but like I was saying before, the keywords I'm taking out of here are going to be those signs and symptoms. So the worsening shortness of breath, the wheezing, the chest tightness, that acute respiratory failure with hypoxia that was diagnosed, and then also that COPD, that chronic obstructive pulmonary disease. All right, and then next we decided what guideline we were going to use. This is going to be the guideline IC10-B1. So that is going to be acute respiratory failure as principal diagnosis. This is obviously chosen because the principal diagnosis on here is going to be that acute respiratory failure. And not only that, but it's going to be acute respiratory failure with hypoxia, which is what we had for our keywords. So that is going to lead us to our first code, which is going to be J96.01, which is the acute respiratory failure with hypoxia. So that was important to add in there. And you can kind of be guided in that direction by looking at our sequencing suggestion over here on the right hand aisle right here. You can see that the acute or subacute, which is what we see in the scenario, is going to be from category J96.0. So that kind of guides you in the right direction. You can kind of find the code that way. And then we also are going to have to code for that COPD as well. And so that is going to bring us to our second code, which is going to be code J44.1, which is going to be chronic obstructive pulmonary disease with acute exacerbation. So again, you can take that pretty much directly out of this scenario when it says further evaluation revealing underlying acute exacerbation of chronic obstructive pulmonary disease. So that definitely matches up with this second code, pretty much word for word. So these are going to be the two codes that are going to best describe this encounter in this sequencing order. So if you got that one right, amazing job. Or if you took a shot, put some answers in the chat, or if you learned something, that is also outstanding, and that is why we are here. That was a great warm-up, in-depth scenario. So now we are going to switch right back over to our Quizlet, and we are going to grab our second scenario for the night, and we are going to, again, start back up with our keywords. We're going to start from the beginning. And then here is going to be the second. So, like I said, J96.01, not 0.0, and then J44.1. So here is our second scenario. A 76-year-old nursing home resident is admitted to the hospital with a stage 2 pressure ulcer of the right heel present on admission, or POA. During the hospital stay, despite treatment and wound care, the ulcer worsens and progresses to a stage 3 pressure ulcer of the same site. So what keywords are we taking out of this encounter to find our guideline and to find our codes eventually? I will give you guys about a minute. Let me know in the chat. Okay, it has been about a minute. As always, if you are still typing your answer, please continue to do so. So what I'm taking out of here is going to be that stage 2 pressure ulcer, and especially that on admission, or the POA, present on admission. and the fact that the ulcer is progressing to a stage 3, and also that this ulcer is going to be on the same site. So those are the keywords I'm taking out of there, and everyone was pretty much along the same lines, so great job. And now we are going to move on to the second part. We are going to be choosing our guideline. Again, this is going to be from between chapters 10 and 14. So we're going to go to that tissue chapter that we were going over. So it's going to kind of be within those guidelines to kind of narrow it down. Let me know in the chat what we think that guideline is, and then we will go over it. It is about that time. So the guideline that we are Okay, so the guideline that we're going to be using for this is going to be from chapter 12. So it's going to be IC-12A6. So pressure ulcer stage codes, specifically patient admitted with pressure ulcer evolving into another stage during admission. So this is most definitely going to be the most helpful guideline that we are going to use to get those final ICD-10 codes. And speaking of the final ICD-10 codes, now we are moving on. Again, using those keywords and using that guideline we just went over, and we are going to be selecting our final ICD-10 codes that best describe this encounter. Again, I will give you guys about a minute, and then we will go over it in our PowerPoint. All right, coders, I'm going to switch over to our PowerPoint really quick, and then we will see how everything looks all together. Definitely continue working if you are still working. Okay. Here we are. Here's going to be our second scenario. Again, I won't read the whole thing, but the keywords that we are taking out of here are going to be, again, that stage 2 pressure ulcer. That's what the stage was on admission. The ulcer progressing into that stage 3, and also the pressure ulcer being of the same site. All right, so here is going to be our guideline. This is just a snippet from the MCG manual. So again, IC-12A6, a pressure ulcer evolving into another stage during the admission. That is definitely what is happening here. So if you look as always, on the right-hand side, you will see this sequencing suggestion, and our first code that it suggests is going to be the POA stage, or the present on admission. So that is why we definitely mentioned that in the keywords. What was the stage of the ulcer on admission? So that's going to lead us to our first code, which is going to be L89.612, and this is going to account for the pressure ulcer of the right heel, stage 2. So that pretty much nails that right on the head, because it matches up with those keywords, stage 2 pressure ulcer and the right heel. So then we have to look back to the sequencing suggestion, and the second code it suggests is the highest stage during admission. So if we go back to the scenario, or we go back to the keywords, we see that that is going to be stage 3. And then we also see that it's the same site. So we also are going to be coding for the right heel like we did in our first code, and that's going to bring us to our second code, which is going to be L89.613, which is going to be pressure ulcer, again, of that right heel, but stage 3. So those are going to be the two codes that are going to best describe this encounter. So if you got that one right, or if you were on the right path, amazing job. Or if you just gave it a shot and put those answers in the chat, amazing job as well. And hopefully this explanation made sense for anyone that was a little unsure about what codes to select. So great job, everyone. And now we are going to, if I can find my mouse, I'm going to stop sharing my screen, and I'm going to switch back over one more time to our Quizlet, and we are going to go over our last in-depth scenario of the night. And again, we are just going to keep the same flow, breaking it down into those 3 different keywords, guidelines, and codes. Okay, so our final scenario for the night: a 68-year-old male patient is seen by his nephrologist for follow-up management of chronic kidney disease, or CKD, stage 4. During the visit, laboratory results and clinical evaluation confirm that the patient has now progressed to end-stage renal disease, or ESRD. The provider documents both chronic kidney disease, stage 4, and ESRD in the assessment. So what keywords are we taking out of this encounter? You guys know the drill. You have about 1 minute to put those keywords in the chat. All right. Great participation for those who put your answers in the chat. So yes, I'm going to take out that stage 4 chronic kidney disease and the progression to the end stage renal disease. You could also put that the doctor, the physician, had the stage 4 chronic kidney disease and also the ESRD as the final diagnosis, but everyone was on the right track in the chat, so great job. All right, now we are going to move on to our guideline. So what guideline out of that ICD-10-CM book or the MCG manual do we think best fits how to solve this scenario? Again, let me know in the chat, and good luck. All right, coders, it is about that time. So the guideline that I'm choosing that best describe this encounter is going to be IC14. So from chapter 14, IC14A1, chronic kidney disease, and then stages of chronic kidney disease, or CKD. So if you got that one right, or you were in the right chapter, amazing job. And now you guys already know the drill. Now we are going to be finding those ICD-10-CM code or codes that best describe this encounter using those keywords and using that guideline. I will give you guys about a minute to come up with these answers, and then we will switch over one final time to our PowerPoint to see how everything looks together. Good luck. Alrighty, I will stop sharing my screen so we can move right over to our PowerPoint. Seeing some great answers so far. Okay, so here is going to be our scenario. Again, we are taking out that stage 4 chronic kidney disease and the progression to ESRD or end-stage renal disease. This is going to be the guideline we're going to be using, the stages of chronic kidney disease. This is a super helpful guideline, even if you are just trying to come up with the codes for the chronic kidney disease stages, because you can see there is this graph right here on the left hand side, the codes for stage 1, stage 2, stage 3, stage 4, and ESRD. So that is super helpful. But as far as this scenario goes, you can even see on this example right here that if both chronic kidney disease stage 4 and ESRD are coded, only the end stage renal disease should be coded. So you don't need to code both of them. You should just code the end stage renal disease. So with that being said, our one and only code we are going to use to best report or best describe this scenario is going to be that N18.6, that end stage renal disease. It also says right here, if both chronic kidney disease stage and end stage renal disease are documented, assign only code N18.6. So if you read anywhere on this guideline, you can see that even though the provider documents both the chronic kidney disease and end-stage renal disease, that you only need to code for that N18.6. So if you got that one right, oh, and it also has right here as a little tip, when both ESRD and chronic kidney disease stage 5, not stage 4, but it still kind of points you in the right direction. So if you caught that one, amazing, amazing job. That was an amazing end to these in-depth scenarios. You guys are really picking up on doing these keywords, guidelines, and codes. So great job. I hope you are happy with this, these in-depth scenarios or this session for today. But as always, don't forget to fill out our survey in the chat. Again, we will post it again in the chat, but definitely give us some feedback on how we're doing in these classes. If you'd like to see anything, crank up the difficulty, anything like that, let us know. Or if you have any questions about anything we went over, also just to let us know how we're doing in these classes, again, so we can make sure that everyone is learning as much as they possibly can. But thank you everyone for taking time out of their Monday to join us for another successful ICD-10 Guideline Mastery session. Thank you so much to my team for being so awesome and amazing as per usual in the chat. And next week we are going to be going over week 7. So we're going to be going over everything in the theme of pregnancy complications, perinatal period, all of that. So definitely join us again at 7 p.m. Eastern Standard Time right back here next Monday. And you guys have a wonderful, wonderful rest of your week. Thank you so much.
4,000 exam passers and free classes at AMCI. Learn to coach straight from home or on the road at AMCI. We're on the East Coast, the West Coast. We're all around.